Good morning, everyone. I'm Sue Stroop. I am your facilitator today for our wonderful Nurse Professional Advancement Lunch and Learn. We have a record-breaking 320 plus RNs registered for this, and I'm so excited to see some of our nurse managers, nurse leaders, colleagues, and friends that will be joining us. I'll give you a quick rundown of our overview today. We have with us our fabulous speakers, Shonda Osborne and Naomi North, and I'll introduce them a little bit later. So today's format is typical lunch and learn format. We'll have our speakers present about 30 minutes of content. Shonda and Naomi have put together a fabulous PowerPoint. We are recording this so that it will be available on the Career Center webpage so that you can have it for your staff meetings and show it for your future nurses. Because I know we're not going to have 320 on Zoom today. But without further ado, I want to first introduce Naomi. Naomi graduated from Lexington Community College with an ADN, and she began her career in our emergency department, where she's worked for 13 years, and she is currently a pediatric emergency nurse. She has enjoyed being on the NPA council, became vice chair in 2021, and now serves as chair in 2023, which is awesome. Welcome, Naomi. And then we have Shonda Osborne. Shonda started her nursing career at Cincinnati Children's Hospital and then came to our Center for Advanced Surgery at UK Healthcare. She's worked in multiple leadership positions, including Marquis Cancer Center, case manager for thoracic surgery and cardiac critical care. She's currently in the clinical documentation specialist improvement program, and she has been the chair for many years, serving as chair for 5 years, and right now is the facilitator for the Nurse Professional Advancement Committee. So excellent speakers today. We're excited to have both of them, and I'll turn it over to Shonda.
Hi guys, I've already gotten kicked off Zoom once because there's just so many of you. So hopefully when I start this presentation, I won't get kicked off again, but let me try to share my screen. And can everyone see the screen now?
Yes.
Okay, I will not put it in presentation because that seems to be when I'm getting kicked off the most. But so I will start just, letting you know, Nurse Professional Advancement Program, and most of you know that. What is professional development? It's the process of improving your practice through continued education and training.
So I wonder if it would help if we all turn our cameras off. I think occasionally Zoom works better when we do that.
I think that would be great. Yes, please do that because Shonda just got kicked off again. That's a great suggestion. I appreciate that. Can you all turn your cameras off so that we can allow Shonda to come back on with her PowerPoint?
Let's try again.
There you go. Yeah, that was a great suggestion. They're all turning their cameras off, so that'll help.
Okay.
Hey, Sue, this is Savannah. Maybe Shonda might need to turn off her camera as well, because I've noticed that if you're presenting and have your camera on at the same time, your computer's thinking too hard.
Okay. Thank you, Savannah.
Okay. There's a couple of people still with their cameras on. If you could turn yours off as well. And then I will just keep the PowerPoint minimized like this instead of in presentation mode. So I want to put in a little plug here for national certifications, just because of the fact that It's going to play into the new NPA a little bit later, but it's also important in and of itself because it demonstrates that you're dedicated to improving your practice. And it also shows other people that you kind of know your stuff. Because national certifications are not easy to get. And if you don't know your stuff, you're not getting one. So pretty much almost any specialty area has a national certification specific to their area. There's some examples on the screen of some more common ones. And if you're ever not sure if your area has national certification, there is a link that is going to be in this PowerPoint that you can go to. Don't forget that UK will pay for your certification and your recertifications. So the last known person that I know of to contact is Andrea Wright. Andrea, I think that you were going to be on here today. So if that's not correct any longer, would you please put who they can contact in the chat? So what is the NPA? So the official mission statement is to provide a structure for professional development where you can make career choices that will be recognized for your contributions to not only your unit, not only to our organization, but the whole community. You know it as the clinical ladder. The short version of that mission statement is just, it's a way to be recognized for things we already do and to also encourage us to seek out new activities to further grow ourselves as professionals. So who is eligible to apply? Any registered nurse at UK can apply. The only difference is some of the benefits once you pass. So non-salaried or hourly nurses who provide direct patient care are going to get the portfolio to use as a performance evaluation component. You're going to get differentials, and you will have the conference money and professional leave, or you can have up to $500 towards a national certification review course and books to support that exam. Salaried RNs are eligible for Platinum Plus or Platinum Advantage level, depending on job title. And you'll see what those mean in just a minute. They're eligible to use that portfolio to support their PE, and they're also available to have some conference money and professional leave. Salaried nurses do not get a differential, so they aren't eligible for NPA differentials either. So this is what the core criteria are, basically. This is an easy spreadsheet to review back to whenever you're trying to see where you fall on what you can apply for on the ladder. So we'll just start with the changes. So Platinum level, you can see that we've decreased the years of nurse experience that are required. You do have to have a bachelor's degree for Platinum level. You do have to have a national certification and be a member of a professional nursing organization. You also have to be a member of a committee. You can see that the differentials and the conference money have not changed yet this year. That was something that the CNOs were supportive of. It just was not in the budget for this fiscal year since the recommendations were made late. So possibly in the future, those things could increase. Gold, you can be an ADN that was hired prior to January 2012 if you're an inpatient ADN, or if you're an ambulatory clinic ADN, you can be gold if you were hired prior to January 2019. Again, you must have a national nursing certification and be a member of a professional organization and a committee. Silver, you just have to have your BSN and you have to have completed your residency program. Same for bronze. That is all you need to be able to be on the ladder. There are no, 2 years of experience, 4 years of experience, things like that required for bronze and silver anymore. You do have to have points for these two. So for silver, you have to have 7 points, bronze, 5 points. Platinum Plus are now for the grade 11 RNs that are salaried, but their work impacts overall care of patients like nurse navigators, case managers, clinical documentation specialists, anything that has an impact on direct patient care. So you do have to have a bachelor's for that and 3 years of RN experience, a national nursing certification, and be a member of a professional nursing organization. So you're going to start off as platinum if you're salaried and you can meet these things. There are no additional lower levels for the salary nurses. And then for nurse managers, nursing operations administrators, and the CNOs and CNEs, you now have something called Platinum Advantage. That is a bachelor's or higher with 3 years of RN experience, national nursing certification, and member of professional nursing organization. For those last two categories, you don't get differentials. So you do get, though, 32 hours for PL for Platinum Plus to go to a conference, and $1,500 towards a conference every 2 years. The 2 years starts at the time that you use your money for a conference. The Platinum Advantage nurses, the managers, nursing operations administrators, CNOs, they will use their NPA as part of their performance evaluation. So a lot of you that are already on NPA are used to having, 4 different packets that you have to figure out which one to use and how to use it. One packet for all levels now, much less confusing, only one packet to look at. Everything else is going away once the SharePoint is updated. You will only see this. So this is your application page. You're going to check off which of these you're going to apply for, whether you're new. Everybody's going to be new initially, but after that, you'll be maintenance when you do your yearly maintenance portfolio. Fill these out. Here's the requirements. And there's your checklist of things that you're going to need to include, plus your tools if you're doing bronze or silver, and then your components if you're doing gold or above. Categories are gone. A lot of you have expressed frustration over the years that especially efficiency was very hard to get points in. So now you have all the points in one pool. So if you need 5 points or you need 7 points, you don't have categories that you have to have 1 point in anymore. You can use any combination of the points now. So before, if maybe you only had all your points in what we termed as professional development, that's okay. You don't have to have 1 point in 5 categories anymore. So they added a couple of categories. Let's see, one of the categories that is kind of exciting is the social determinants of health category. As a lot of you know, that's become a pretty a more focused issue these days that everybody's talking about. Case managers are really evaluating that. Bedside nurses are very instrumental in helping identify things that people need help with in order to take better care of themselves. So anything you do around that can be used as a point now. Just have to document that. What did go away was the unscheduled hours point for 2 reasons. Unscheduled hours aren't necessarily part of developing yourself professionally as a nurse. It is something that you do to help out each other and the enterprise, but you also get paid for that with overtime and sometimes surge pay. So that did go away, but for anything that was taken away, something replaced it. So hence the social determinants of health point. That is new. All of the other points that were on there before, I believe, are there. Just you can use them in any combination now. So how to get started. Use that points page in the glossary of terms located on the SharePoint to see what points you've already accomplished. For new portfolios, your activities can go back for 18 months. If you're new to UK and you've been here, say 12 months, and you have some points that you could use, but they were at your old facility, that's okay too. You just need to make sure you have the required documentation included in your portfolio. Maintenance portfolios, you can still go back 12 months because you go from the time that you advance to your next year and you use the points in between those. If you are lacking in points and you are trying to get bronze or silver, the glossary of terms can help you get some ideas on how to obtain the points you lack. The glossary of terms basically define every point and what is required to be turned in to get that point. at least 1 month prior to when you plan to turn in your portfolio, you want to contact an NPA rep to set up a meeting. There's a list of all the representatives on the NPA SharePoint. If your unit does not have a representative, use that list to find someone that you can go to. It's usually easier, I think, to find somebody that's in a unit close to where you are, so that if you need to, meet up, you're kind of close to each other, maybe like a floor down or something like that. But you can contact any representative on that list to have your questions answered, to meet, to go over the portfolio, anything like that. So once you set up that meeting, they're going to meet with you, briefly review your portfolio for the most common errors, and explain the review process to you. If they find something that you need to fix, that gives you enough time to correct the error before you plan to turn in that portfolio. It's not a guarantee that your portfolio will pass the formal review because they sign off on it, because they're just looking for the most common errors that we see. But they have to sign it before you submit that portfolio. It will get returned unreviewed if it's not signed by an NPA rep. So once you're ready to apply, you're going to turn the portfolio into N100 administration offices at Chandler. That is a new location for those of you who have been on NPA for the last few years. Central staffing ran out of room, and so now it will be located at N100 administration offices. And at Good Sam, it's at the DCN HOA office. The deadline to turn in portfolios, especially for you maintenance people, is 11:59 p.m. the last day of each month. They will be picked up the first business day of the month. Any portfolios received after the deadline won't be reviewed until the following month. So for Gold and Platinum, going to be pretty easy to submit your portfolios now. You're going to print out the application, the supervisor support page, tool number 2, which is the committee tool, and your resume. Complete that stuff with the appropriate signatures. Do your exemplar if you are a new application, and obtain your proof of membership in your organization, proof of your national nursing certification, put it in a folder, get your NPA rep signature, you're done. So no points anymore to worry about, no 50 million tools, anything like that, because, for Gold and Platinum, it was a lot of points and you had to do a lot of tools. So it's going to be fairly easy. Just, get those national nursing certifications. What happens after you apply? The NPA committee meets the second Tuesday of each month. 2 reviewers review each portfolio, determine its status. Passing portfolios, the information is sent to nursing payroll. Any portfolio that does not meet all criteria will be returned with notes for revision. Returned portfolios, they may be resubmitted for the next meeting. So you don't have to wait a month or anything like that. As soon as you fix it, turn it in. The next meeting after you turn it in, it'll be reviewed. Your portfolios are required to be renewed yearly to maintain your standing. So say you pass in September of 2024, then your next portfolio is going to be due by midnight on August 31st, 2025, because you're going to need to pass in September again the next year. We will not be sending out reminders for that. So part of, professional development is also keeping up with deadlines. So that is up to you to remember when your portfolio is due for the next year. Managers usually keep track of these things too. When you pass, you should be giving your manager a copy of the sheet that will be included in your portfolio when you get it back, showing that you passed, for your personnel file and for their records. So, you can always ask if they will send you a reminder, but otherwise you're responsible for keeping up with your own deadline. So if you look at it and you have any questions, NPA representatives are always available by email. You can email anybody on that list, and they will find an answer for you if they don't know it off the top of their head. But it definitely is going to be a lot easier from now on. If you want to get involved, you need a committee to be on, you want to have your voice heard in professional development, there are 2 councils that are for you. One is the Professional Development Council. It meets to promote continued professional growth of nurses at UK by providing educational opportunities. They meet monthly. They meet on Shared Governance Day, which is the second Wednesday of every month. We are recruiting new members with preference to some staff nurses. We need more, floor nurses, bedside nurses on this committee. You can contact Crystal Justice for more information. And of course, NPA, we are recruiting new members now as of September 1st. We need people from areas without representation. So you can go look at the list of active members, see if your area has representation. If they don't, please consider joining NPA. You must already be advanced and current on the ladder to be a member. So you will complete an application that's located on the SharePoint and email it to our chairperson. Currently, that is Naomi. I'm going to go back to this grid just for a minute as we start asking questions. I'm going to go over some of the questions that came in before this and see if I can help answer them. So one of them was, how can I best encourage my nurses to participate? That's a tough question for the NPA to answer because I don't know your nurses as well as you do. But if you have a nurse that is already doing some of the tasks that you've seen on here for points, they should use those. If you have a nurse that's nationally certified, there's absolutely no reason that any certified nurse can't be on the ladder. Hopefully this new process will also encourage your nurses to obtain their national certification and or do the points to be on the ladder. The other one was, how long will we have to get things together? I'm assuming that question is geared toward the people who were due while the NPA was frozen. And so for that, anybody that was due between January 31st for a February review and August 31st for a September review, you will have 3 months to submit your new portfolio before your differential is removed. That means your new portfolio should be submitted sometime between September 1st when we go live and 11:59 p.m. on November 30th. It will need to be submitted as a new portfolio under the new ladder with a new exemplar. And then after that, it will go back to being maintenance where you won't need an exemplar. Your differentials will not be removed unless you do not submit by 11:59 p.m. November 30th. If you're a nationally certified nurse, it should be a breeze for you to get that in. Let's see, I've answered that one. Someone said that they feel their certifications should be worth more than just a checkbox in the box for NPA. I think that we've definitely shown that we agree with taking away all of the points needed to get gold and platinum if you have a national nursing certification. So, the hospital felt like that should be acknowledged in some way. There's nothing that NPA can do about getting nationally certified nurses more money on their base salary. I know that other places do from what I'm reading on these questions, but we can't do that. So we have done our best to acknowledge all the work that goes into a national certification by making it a lot easier for those nurses to get gold and platinum on the ladder and get that differential. Are managers eligible for the ladder and diffs? So as you saw on the maybe on the grid, you are eligible now, but you are not eligible for differentials. If there is a manager that is hourly, you're still in management, and so that is not considered for differentials, as the NPA historically has been geared toward direct patient care nurses. But we have been able to include you on there and be able to let you use that for your performance evaluations. What are time constraints for the program? I'm not exactly sure what was meant by that question, but if you mean, how long does it take you to put a portfolio together? Because that was another question. That's very individualized, as well as difficulty. I had quite a few questions saying that they've heard from other nurses that it's very difficult to put a portfolio together. I think difficulty is a perception that's very individual. As an outpatient nurse, I was platinum for many years. I personally did not find it difficult. It was just things I was doing already throughout the year. I just had to get a tool signed every time I did them. But so it's very individualized, as is the time that it's going to take you to put a portfolio together. If you're a nationally certified nurse, I would think it would take you maybe 10 minutes to put a portfolio together now. And then you have to still get the NPA rep signature, but that shouldn't take long either. The ones that require points, 7 and 5 points, that's not that much to put together. You really have to kind of think about the things you're doing throughout the year as you go along. And it's easier if you get the documentation that you need right when you do it, and then put it in a folder somewhere, so that when it is time to put your portfolio together, it's not going to take you long at all. Let's see. How can we navigate the rapidly changing nursing culture of short-term tenures? That's also a question that might be good to ask of the retention council. Let's see, it makes training and retaining more of a challenge, limits the perceived value of professional development. So again, question for the retention committee. However, with the decrease of numbers of years of experience required for NPA, hopefully more of the nurses will climb the ladder. I think that perception of value is also individual. So I feel like it's up to like managers and educators to kind of educate people on the value of developing themselves as a professional, what it can mean for their future career as a nurse. The more professionally developed you are, the more marketable you are. National nursing certification makes you more marketable. And that's within this enterprise as well. There are a lot of opportunities within the enterprise. But, for a lot of them, you do need to kind of grow yourself. Just showing up to work every day doesn't necessarily help you grow in your career. So it all depends on what you want and what kind of work you want to put into it. So I think it's good for us, especially us older nurses, to kind of talk to every, the new nurses coming on that you're referencing, and explain to them what the value of these things have been for you. There was a question saying that they felt like the outpatient nurses should have a different ladder than the inpatient nurses, that they don't have opportunities for points. I think that's something that maybe you could talk to your managers about. As I mentioned earlier, I was a platinum on the ladder for many years, and I did that as an outpatient in Markey Cancer Center. So there are absolutely opportunities to make points, but sometimes you have to, find those opportunities yourself and develop them yourself. For example, informal teaching. Find something in your clinic that you can teach to the other nurses about. Let your manager know, hey, I want to do an in-service on, I don't know, the proper way to collect labs or something like that. If your clinic collects labs, some do and some don't. But it's not that difficult to make your own opportunities sometimes. Present a literature review. Anybody can do that. Community service. Anybody can do that. Individual acknowledgements. You just need to start praising each other. Send your coworker a star through the star system, or an individual acknowledgement, not a star, but you can send acknowledgements through the star system when they help you out. Not only does that help morale, but that's going to be a point for them in the ladder once they collect 3. So there's definitely points available for any nurse in this enterprise. 30 CEUs, anybody can do that. Enrichment class, anybody can do that. You just have to seek those opportunities out. The last question was, how do you plan to compensate people who haven't been able to climb the ladder for the last several months while it was being worked on and have been unable to earn more? So if you were current on the ladder when it was frozen, you have been receiving your differential for all these months. If you were not already on the ladder, or you wanted to advance a level, there's no additional compensation, because that's, you know, that would be compensating you on a what if, and we just aren't able to do that. But if you were already on the ladder, you've been getting compensated while it was frozen. So that was all the questions that I had that were sent in. Does anybody have any other ones right now?
Shonda, there are a lot that came in the chat. So if you could look at the chat, that would be great.
Okay, let me look here.
And I know,
I am trying to answer and reply as I can. Sorry.
yeah, Naomi's done a great
And
job.
I know I
She
talked
did.
really fast, and I'm sorry, but it's a lot for the time constraints.
Yes, it is. But you did an
Well, we
excellent
have
job.
I assume you answered that.
I think I saw two questions about, are there examples of the exemplar anywhere?
So Patty is working on that. The exemplar has kind of changed. Now the exemplar will be based on something that you've done that meets something in the nurse strategic plan, or something in Magnet, or something from our values. So Patty is supposed to be working on some examples of that for us.
Patty Hughes.
Yes, sorry.
Okay, great. And then couple of questions have come in about where do they get the link to access all the paperwork? Will you add that to your PowerPoint?
I can. If in the meantime, if you go to the new nursing resources page on the Loop, the link is there to the NPA.
Wonderful.
Oh, I like that idea, Brandy. Brandy kind of, for those of you that aren't reading the chat, Brandy kind of also answered the one about how to get our nurses, how to encourage our nurses to join. So she had an idea that maybe you could have a challenge between your unit and maybe another unit, like who can have the most nurses join NPA. That's an awesome idea. I like that. Assistant managers and CE fall on, so the managers fall under the management, even though they're hourly, they're still management. The C&E, I believe, would fall under direct patient care. In so the definition of direct patient care for NPA has historically been hands-on care, people that directly educate family inpatients, such as the nurse navigators and the case managers, and people that do direct bedside coaching of other nurses. So we can clarify that with Patty or Brandy, but I believe that if they're hourly, they would still fall under the one for the hourly. Brandy, do you know if that's true? Are you still here? We can get that clarified, and I can add that to the PowerPoint as well. Do you need to be a part of a professional organization and committee? For platinum and gold, yes. For platinum and gold, committee work shows your dedication to professionally develop yourself to a higher level. So you are required to be on a committee for gold and platinum.
Also wanted to mention to everyone that Shonda and Naomi will be updating their PowerPoint with a few of the Q&A questions. This will be sent out to everyone that pre-registered. And the video recording will be up on the Career Center webpage. So I did put that in the chat, but I can do it again. And it
Do
probably
silver-
will not go up until next week.
Do silver and bronze still require council membership? No, they do not. Yes, did I say that we have to do a new one, and even if you're already on the NPA? Yes, you do, because you're not on the new criteria for NPA. The only thing different for you will that you'll need to include an exemplar your first time under the new NPA. Molly Baker, it is years of experience as an RN, not at UK.
And then you just got a new question from Matthew Crafton. How much RN experience is needed to not be considered a new graduate nurse?
You must have completed your residency program. So I think residency program is a year long. Is that correct? Does anybody know?
Yes, it's a year long.
So once you have completed your residency program, you can apply for bronze or silver. How do we know how much point we need for silver? It is right here on this grid. You're going to need a minimum of 7 points for silver, 5 points for bronze. Previously on the ladder as an hourly grade, 11 C&E. C&Es are listed as no differential now. Oh, I see what you're talking about under Platinum Advantage. We will clarify that with Patty and Brandy, and we can take that off if they've changed or see if they've changed that for some reason. Because you are correct. I know that Brian and I had talked a couple of times about that over the years, Brian Klein. And it was included at that point, but I think it means chief nurse executive rather than clinical nurse educator is my guess. Which Savannah said after that.
I think you're getting
Okay.
all of them. We're trying to
Yeah.
monitor the chat.
Team leads, I believe your actual title is probably still clinical nurse. So that's kind of what we're looking at. That is correct, Karen. No points are required for gold and platinum, just your national certification, membership in a professional organization, and your committee work. How far back can I go in writing an exemplar? That is entirely up to you. You just need to show that you've done something that speaks to one of those tenets that are going to be on there about Magnet, the enterprise values, or the nursing strategic plan. Is conference money able to be reimbursed? So this is what you're eligible for on this grid. And you can contact Andrea or whoever is doing that now about reimbursement. Tara, I'm not sure what you mean by what are the guidelines tool for points. These are the points available to you to earn. If you need to know what to do to meet the requirement for that point, that's in the glossary of terms on the NPA SharePoint site. For example, when you read under individual acknowledgements in there, it also says must have 3 here, but it will explain to you that you must have 3 and that you cannot use ones that were sent to every nurse in the enterprise, like when Gwen sends out thank you for like Nurses Week and stuff like that. If you have previous RN experience before joining UK, they want to know if they have to complete the residency program. You know, if you have previous RN experience, I wouldn't think they would put you in the residency program, but I'm not an expert on that. So I don't know if you're saying if you have 6 months RN experience here and you experience before you come here, will they still put you in the residency program? I don't know the answer to that. But if not, in that case, you would need 1 year of RN experience, like you had completed the residency program, if that makes sense.
Yes, any questions for nurse residency can be emailed to Janine Lindgren, and she is our nurse residency coordinator, Lindgreen.
Where do nurses who do not speak to patients, however, live in charts daily? Ashley, so I'm in that group too as a clinical documentation specialist, and we are here under Platinum Plus. All of the ones that are hourly with differentials are geared towards people who have direct patient care or family care, like I was mentioning earlier. So in Platinum Plus, you can see that their work impacts overall care of patients, but we don't impact the direct patient care like a case manager does, where they're going and they're talking about things with the patient or their family and getting them resources and actually affecting their health in some way. But we can clarify that. If you want to send an email with your exact job title, we can send that to Patty and Brandy, and they can figure that out with the CNOs. And you will be able to print the application packet from the same place as the last one was found once it goes live. It's not all been updated and uploaded yet. Can the money be used during the 2 years or only once every 2 years? Only once every 2 years. So if you used it this month, you wouldn't be able to use it again until after August of 2026.
When will it be loaded to the
Juniors
site?
hired at
Brenda?
UK need to be at UK for a year to apply. No.
And are you loading everything for September 1? Is that your goal, to load everything?
Correct.
All right, well, we're about 3 minutes till we conclude. This has been amazing. I do want to historically say that the Career Center has never hosted a lunch and learn with 193 participants. So thank you to Shonda and Naomi for all the hard work, and to the NPA council that did a lot of work over the last year to make this all happen and make it so easy, much easier for all of us. As I mentioned previously in the chat, all of this, when Shonda and Naomi update the PowerPoint with a couple of your questions and some links, that will be sent out to everyone that pre-registered. And the video recording will be on the Career Center website. So you can access it. So your night shift nurses can access it as well, or you can go back and look over it for further clarification. Any last questions? Oh, wow. Most of them are thank yous. Thank you, Shonda. Thank you, Naomi. Thank you, everyone. Great, great job. Well, I'm so glad that this was helpful, because I know everyone's been asking me, and I'm like, we have to wait till the lunch and learn. It was
Thank
very
you guys
daunting.
so much for being here.
Yeah, it was very daunting before. I'm so glad that you've made it so much easier.
Yeah, it definitely is a lot easier to get there now.
Will there be leniency for those due on September and October since this was on hold for 6 months?
As I mentioned earlier, you have until 11:59 p.m. on November 30th. That's the leniency. You must pass in the December meeting to keep your differential. As this was frozen, you probably were still working on points, not knowing, or hopefully you were. If you have a national nursing certification, should be super easy for you to be gold or platinum now. If you were working under the assumption that you'd be going by the old guidelines for your maintenance portfolio. So that actually gives you all of September, all of October, and all of November.
All righty, well, we've hit the 12:15 mark. Thank you again for all of you that logged on today. At the peak, we had 193, so that definitely is record breaking. Want to thank Shonda and Naomi again. You did an excellent job keeping up with all the questions and presenting this in a very clear and concise manner. I think it was outstanding. I think it's definitely one of the best lunch and learns we've had in 12 years. How's that? So again, thank you all. We will be sending out the PowerPoint when it gets updated, and as well as the video, the link to the video recording. So everybody can log off and go back and have a great day, and happy Labor Day weekend coming up. Have a safe and healthy Labor Day. And for those of you who are laboring on Labor Day, I wish you hopefully not a lot of craziness. Thanks again, everyone. And Shonda.